Charcot foot by Stephanie Joseph of Indiana State University, Nursing 444, Community Health Nursing, Clinical Health Education Project 1. Charcot foot pretest. Number 1, what is Charcot foot? 2, how is Charcot foot developed? 3, who is the most at risk for Charcot foot? 4, what is the treatment of Charcot foot? For this PowerPoint presentation, the learning objectives for the learner will be to define what Charcot foot is, to describe how Charcot foot is developed, to explain how Charcot foot affects people, to describe complications of Charcot foot, and lastly, to describe the treatment of Charcot foot. Charcot foot is a condition causing weakening of the bones in the foot that can occur in people who have significant nerve damage, which is neuropathy. The bones are weakened enough to fracture, and with continued walking, the foot eventually changes shape. As this disorder progresses, the joints collapse and the foot takes on an abnormal shape, which is called rocker bottom appearance. Charcot foot is a serious condition that can lead to severe deformities, disability, and even amputation. Because of the seriousness, it is important that all patients, but mostly patients living with diabetes, which is a disease that often is associated with neuropathy, take preventative measures and seek immediate care if signs or symptoms appear. To describe Charcot foot, let's take a look at the picture to your right. As you can see, this is an abnormally shaped foot, which is described in the picture as acute Charcot foot. Diabetes also can damage blood vessels, which decreases the blood flow to the feet. Poor circulation weakens the bone and can cause disintegration of the bones and the joint in the foot and ankle. As a result, people who have diabetes are at a higher risk for breaking bones in their feet. When a diabetic fractures a foot in the foot, he or she may not realize it because of the nerve damage. Continuing to walk on an injured foot results in more severe fractures and joint dislocations. Sharp edges of the broken bone within the foot can point downward toward the ground, increasing the risk for a chronic foot sore from the abnormal pressure, as illustrated in the photo. The combination of disintegration and trauma can warp and deform the shape of the foot. It is a condition called Charcot foot arthropathy and is one of the most serious foot problems that diabetics face, but it also can have an effect on anyone. While technically there is no precise cause for Charcot foot affects people who can't feel anything in their feet and ankle because of nerve damage. That's a common problem for people with diabetes, but other things can be a contributing factor towards the nerve damage as well, such as alcohol or drug abuse, an infection, spinal cord disease or injury, Parkinson's disease, HIV, and syphilis. There's no specific cause, as I told you before, for Charcot foot, but there are some things that can be triggers for it, such as a sprain or broken bone that doesn't get treatment quickly, a sore on your foot that doesn't heal, an infection, a foot surgery that heals slowly. As these problems begin, you may not know that your foot is hurt, since nerve damage keeps you from feeling the pain. So the injury or the sore gets worse as you walk on it. Then the bones in the foot begin to lose the calcium that makes them strong. Some key signs and symptoms of Charcot foot that many people may notice with Charcot foot, typically you will not have much pain. They may have other symptoms such as the most sensitive and earliest signs of Charcot foot is swelling of the foot. This can occur without an obvious injury. Redness of the foot can also occur in the early stages. The swelling, redness, and change to the bone that are seen on an x-ray may be confused for a bone infection. But a bone infection is very unlikely if the skin is intact and there is no obvious signs of ulcer present. As you can see to the diagram to the left, how the bones are affected and they drop down, causing that sore to open. Complications of Charcot foot can be, as your bones get weaker, they can break and move out of place. When that happens, your foot may lose its shape. The arc of the middle of your foot may drop until the bones are lower than your heel or toes. Doctors sometimes call this rocker bottom. Your toes may curl. Your ankle might become twisted and unsteady. Bones may press against your shoes. This can cause open sores, which can also cause open sores on your skin that can get infected. Poor blood flow, which is a common side effect of diabetes, may make it hard for an infection to heal. If that goes on too long, you may need to have your foot amputated. There are various different types of treatment for Charcot foot. The non-surgical treatment usually involves casting. The early stages of Charcot foot are usually treated with a cast or a cast type boot to protect the foot and ankle. The use of a cast is very effective in reducing the swelling and protecting the bones. Casting usually requires the patient to be non-weight bearing on the foot until the bones begin to heal. The use of crutches, a knee walker, and even a wheelchair are usually necessary. Healing can sometimes take up to 3 months or more. The cast is usually changed every week or two to make sure that it continues to fit the leg as the swelling goes down. Custom shoes is also a non-surgical treatment option. After the initial swelling has decreased and the bones begin to fuse back together, a specialized custom walking boot or diabetic shoe may be recommended. The specialized shoe is designed to reduce the risk of ulcers, to take the pressure off where the bones have dropped down into that foot. Some diabetics may not be able to wear regular or over-the-counter shoes because they no longer fit them with the deformed foot. The second treatment option is surgery. Surgical treatment may be recommended if the foot deformity puts the patient at a higher risk for ulcers or if the protective shoe wear is not effective. Unstable fractures and dislocations also require surgery to heal. The recovery process for the treatment of Charcot foot. Healing may require several months. Healing times for surgery may be twice the usual duration for those that are non-diabetic. With Charcot foot and ankle, healing after fusion may require 6 months of protection and subsequent orthotic placement. The outcome is usually for Charcot foot may occur or flare up. Therefore, bilateral involvement is common. Therefore, impairment with this condition is permanent. Patients use protective footwear and orthotics and limit standing and walking to require for activities of daily living. Regular lifelong follow-up is required with a specialist. Complications can be severe deformities that may include collapse of the midfoot arc with associated plantar midfoot ulcers. Deformities may occur in any part of the foot and ankle and result in ulcers from bony pressure against the shoe or ground. Ulcers may become infected, and infections may be limb and life-threatening. Some Charcot joints, such as the ankle, may heal with fibrous tissue, and this may result in gross instability that may predispose to ulcers and may be difficult to support with braces. So what to take away from all of this? Focus on your feet. Whether you've had Charcot foot or want to prevent it, make sure you care for your feet. Get regular checkups with a doctor who treats feet or diabetic foot problems. Check your feet carefully every day. Look for swelling, redness, warm spots, or sores. Check between your toes as well. Wash and dry your feet every day. Also, remember to wear socks and shoes all the time, as much as possible, and always remember to change your socks. Charcot foot post test. 1. What is Charcot foot? 2. How is Charcot foot developed? 3. Who is the most at risk for developing Charcot foot? 4. What is the treatment of Charcot foot? From the conclusion of this PowerPoint, each and every one of you should be able to answer these questions. This concludes the Charcot foot presentation for Nursing 444 Community Health Nursing at Indiana State University, Community Health Project 1. Remember, always take care of your feet. You only get one pair.